Hi guys, welcome back. It's Pet Cancer Awareness Month, and last week we talked about the relationship between carbs and cancer. This week we're going to be answering the question of if these very low carb or ketogenic diets are what is best for you to feed to your pet if they've been diagnosed with cancer. What's important to note is that a lot of the research has been done on humans and lab animals, and there's very little research that's done on our companion dogs and cats. There are some studies that have been performed that show some important differences between animals and people, and one of them is about how quickly we can go into ketosis, basically utilizing the breakdown products of fat. In humans, it seems to happen as quickly as 48 hours, where in animals, it seems to take on an average of a few weeks, even sometimes longer. And that seems to be because they can actually mobilize and utilize glucose that's stored in the body in different places like the liver much better than people can. The other thing that's important to note is that when you decrease the carbohydrate in a diet, you have to increase the fat and the protein. And for some patients, that's going to be very bad. Those with a history of pancreatitis or kidney disease or liver disease. The other thing that's important is that when you feed these very high-fat diets, it can actually be very imbalancing and cause a fair amount of intestinal dysbiosis, basically disrupting the ecosystem of organisms or the microbiome, which is where the majority of the immune system is housed. And for certain cancer patients, especially those undergoing certain treatments, that can be very bad. So the answer again is it's complicated, and it should always be on an individualized basis of what the best diet to feed is. So I hope that information's been helpful, and I'll see you guys soon.